Welcome to our video on how PIP assessors might try to catch you out. Today, we're going to explore some of the tactics used during PIP assessments that you should be aware of. Stay tuned to arm yourself with knowledge and navigate your assessment with confidence. Before we dive in, don't forget to hit like, subscribe, and comment below with any experiences or questions you might have about PIP assessments. Your interaction helps us reach more people with valuable information. In this video, we'll break down what PIP assessors look for and how that might sometimes feel like they're trying to catch you out. We will explore the nuances of the assessment process and discuss specific areas where misunderstandings commonly occur. This will help you prepare effectively for your interview. Understanding the context of PIP assessments is crucial. These assessments are designed to evaluate how your health condition or disability affects your daily life, not just to confirm the existence of a medical condition. Often, the way questions are asked can lead applicants to underestimate their needs or downplay their difficulties. Now, let's get into the details. It's common for assessors to ask questions that seem simple but are actually layered with complexity. For instance, when an assessor asks about your daily routines, they are not just gathering information about what tasks you can do, they are also checking the consistency and reliability with which you can do them. Misunderstanding the intent behind the questions can lead to answers that do not fully represent your challenges. Assessors often observe not just what you say, but how you say it. If there's a discrepancy between your verbal answers and your non-verbal cues, this might raise doubts about the authenticity of your claims. It's important to be consistent in your verbal and non-verbal communication. Remember, assessors are also noting your physical appearance and actions during the assessment. If you mention having mobility issues but walk into the assessment room without showing visible difficulty, this might be noted, even if your condition varies in intensity from day to day. Another tactic could be asking the same question in different ways throughout the assessment. This is a method used to check for consistency in your responses. Inconsistencies, even if they're due to nervousness or the stress of the situation, can be interpreted as inaccuracy. Assessors might also ask about your day on a particularly good day and compare it to your usual days. Many applicants make the mistake of not clarifying how often their good days occur, which can lead to an assessment outcome that does not fully reflect their regular struggle. It is also not uncommon for assessors to ask about medications or treatments in a way that seems to imply if you are receiving treatment, you are not severely impacted. It's vital to explain not just what treatments you're receiving, but how effective they are and what your symptoms are like on an ongoing basis. They might also observe how you handle documents, your bag, or even seating arrangements during the assessment. These small actions can be interpreted in ways that might not truly reflect your day-to-day abilities and challenges. Questions about social interactions and hobbies can also be tricky. If you mention socializing or engaging in hobbies, be clear about the frequency and the level of assistance or adjustments you need to participate in these activities. Lastly, it is crucial to prepare for your assessment by understanding the criteria and having clear, consistent information about how your condition affects you. Being overly nervous can lead to rushed answers that don't fully convey your situation. Practice how to explain your daily challenges clearly and thoroughly. By being aware of these tactics and preparing accordingly, you can ensure that your PIP assessment accurately reflects your needs. Remember, the goal is to get a fair evaluation, so understanding what might seem like attempts to catch you out can greatly aid in presenting your case effectively. Here are some essential steps to take when preparing for a PIP assessment to ensure that you are not caught off guard by the assessor's tactics. Firstly, thoroughly understand the PIP assessment criteria. This means knowing the specific areas assessors are evaluating, such as daily living and mobility. The more informed you are, the better prepared you will be to address relevant points during your assessment. Next, gather and organize supporting documents and evidence well before your assessment date. This includes medical reports, a diary of your daily activities, statements from carers, or anything else that substantiates your claim. Having detailed evidence can help clarify the extent of your needs. It's also beneficial to practice your responses to common questions you might face during the assessment. Consider having a mock interview with a friend or family member. This can help ease your nerves and refine your ability to convey crucial information effectively. Be precise when discussing your bad days versus your good days. Make sure the assessor understands the frequency and severity of your bad days and how they impact your ability to function compared to your good days. When describing your daily activities and limitations, be as detailed as possible. Avoid vague descriptions and ensure that you communicate the assistance you require for your activities, no matter how small or intermittent the help might be. During the assessment, be consistent in your verbal and non-verbal communication. If you discuss limitations or pain, ensure your body language does not suggest otherwise. Consistency helps in building your credibility. Prepare to explain any discrepancies that might appear between previous assessments or reports and your current situation. Changes in condition, whether improvements or deteriorations, should be clearly explained to avoid any misinterpretations. Lastly, stay calm and take your time answering questions. Rushed answers can lead to incomplete information or miscommunication. If you need a moment to think about your answer, take it. This helps ensure that your responses are thorough and reflective of your actual situation. Before we move on to the rest of the video, if you are finding this helpful, please like, subscribe, and comment, as it really helps this video reach a wider audience. Here is a case study related to how PIP assessors try to catch you out. Sarah, a PIP applicant from Manchester, faced significant challenges due to her chronic pain condition. Aware that assessors might misinterpret her varying symptoms, she meticulously prepared by keeping a detailed diary of her daily struggles and pain levels. This diary included specific instances where she required assistance for basic tasks like cooking and washing, which varied from day to day. During her assessment, Sarah brought along her diary and medical reports, which provided a clear, documented timeline of her condition. She practiced explaining her symptoms and how they impacted her daily life, making sure to clearly differentiate her abilities on good days versus bad days. Her thorough preparation paid off, as she was able to present a consistent and well-documented case that led to a fair assessment of her needs. To manage your PIP assessment effectively, it is crucial to prepare detailed documentation of how your condition affects you. This might include a diary or a log that captures the nuances of your daily experiences and the specific help you need. Gather and organize all relevant medical documentation and any other forms of evidence that support your claim, as this will strengthen your case. Additionally, understand the assessment criteria fully and align your documented evidence with these criteria. Be clear, consistent, and honest in your communication during the assessment. Remember, the goal is not just to list your disabilities, but to show how they impact your daily life. If you're well prepared, you can navigate the assessment with confidence and ensure that the outcome reflects your true daily challenges. If you found this video useful, please do hit the like button and subscribe to our channel. Your support is greatly appreciated and helps us to bring more helpful content to you and others. Thank you for watching.